Stillwater's Morning Scramble. Glad to have you here. I'm working on my new novel. Would you like to know the title of it?
What is the title of the novel, Steve?
So You Wanted to Be Mayor.
That sounds like a horror story, actually.
I haven't decided the twists and turns. It's going to have a happy ending now. How's that?
I hope that's. I can't wait to read it.
So You Wanted to Be Mayor. The mayor is in. Well, Joyce, appreciate you coming in. As we've done every Monday here for a while.
Yeah,
This is your spot
thanks
now.
for having me.
And I really do appreciate it. We get, I think that's what people want to hear is what's coming from the top. And it's changed a lot since I talked to you last week. I don't know what the numbers were of positive cases a week ago. Were they at 45 last Monday?
Overall,
Yeah.
I don't.
Because it's 100 as of
No, I mean, I think
yesterday.
it was last Monday. It was just at still in the 20s.
in the city of Stillwater, right?
Yeah, in the
Yeah,
city.
yeah. I was going countywide.
Yeah, countywide. Yeah, 45, 50, 45, 46, something like that. Because we had a couple. We were at 22 in the city on May 31st, on June 1st. We had a couple like June 2nd, June 3rd. We had a couple, and then last Monday we had like 3, and then it was just sort of skyrocketed from there because it was Thursday, Friday, and then Saturday's numbers that were. I mean, we had 22 on Saturday, which is as many as we had the whole 3-month period before that.
So we were at 22 a week ago, a Monday,
Yep.
in the city. Where are we in the city today? Before the new announcements coming up.
72.
72
We've
now
had
in the
50
city.
new cases in June. So we've had more than double the cases we had previously just since June 2nd.
And with the amount of tests that have been taken here, that's going to, we don't know what's going to happen this week, right?
So that's, I mean, we're putting the numbers out and letting people know what's going on and where the numbers are. And I've gotten a lot of response as well. Aren't they testing more? Well, isn't it this? Isn't it that? And what are the explanations for it? And there's a lot of factors for sure. I mean, the testing, overall testing prevalence, how many tests are being given. Now, I don't have great numbers locally, right? Because the county does it, the hospital does some, doctors' offices can do them, the urgent cares do them, right? We don't get I don't get a report every day that says, here's how many people took tests in Stillwater today. The statewide numbers, you have to even extrapolate it from their reports. You have to do a little math on their daily reports to try to figure out how many tests were given. So it's going up, certainly. The amount of tests given is going up. And I think in Stillwater, for sure, since we've had this little outbreak, more people have gone and gotten tested, right? So if, I saw that Hideaway announced that someone there tested positive, that they were going to be closed for a little while. And, I think everybody that works there went and got a test, right? So that's a big surge just in and of itself in sort of the tests being given, right? Because none of those people had symptoms, or I assume, I don't really know, but I assume none of them really had symptoms, right? So I think locally we certainly have had a big jump over the last week and a half or so in asymptomatic people who don't think they were, didn't think they had it, but they potentially were around somebody that had it that went and got tested.
Now, you have been tested now.
I went and got tested on Friday.
Okay. Are the results in?
No.
Okay.
And I don't have any symptoms, and I have really no reason to go do that. I haven't been around anybody.
Well, you're the mayor, so I understand.
I just, honestly, I've been kind of thinking about it for a while because I wanted to see what the experience was like. I called the Payne County Health Department to get a test. They scheduled me like the next morning. It was right away. Went in, drove up. They did it in and out in 5 minutes. Very easy to get that done. So, I did that, just kind of given that I had been out and around and sort of, I don't have any specific reason to think I might have it. And I certainly don't have any symptoms, but, it would seem like a reasonable thing to go do, given where we are in the
So
community.
are tests readily available like that for all of us then? If I wanted to be tested, and
Yes.
I'll wait until a certain party calls me. That's
Sure. Yeah, I mean, I think, like I said, I called the health department on, I think, Thursday afternoon, and they got me in Friday morning.
Yeah.
I mean, it wasn't, and
people want to know about the cost.
The health department test is free,
Right?
if you want to go, if you go through your doctor, that I don't think that's free. And there are certain, I think the urgent cares have some faster tests that they can do. So there are a number of options that you can call around and ask for testing, but the health department provides it free of charge in a drive-up setting.
And yours was the thorough one, because I've heard of different ones where they're not as invasive.
Well, yeah, I think
Yours
there's
kind
one
of
that
was.
yeah. So this one was the swab that they stick into your nasal cavity.
Yeah.
Not the most comfortable thing in the world, but it was quick and really not too bad. And really, I think I assume handled by some National Guard folks because they were both wearing fatigues. The folks that were
They probably
performing
didn't think that was
tests.
going to be their job, right?
You know,
Well, if they're in the medical field.
sure.
Yeah.
I mean, I think it's great that we have those folks available and
Absolutely.
they make themselves available and volunteer to be in those positions to come in and help out when needed, right? So, so all that to say, I think testing certainly there have been a lot more tests performed in Stillwater in the last week and a half
Sure.
than there were the week and a half or the month and a half before that. So, at some level, yes, you would expect higher positives just given the number of tests performed. Because as far as I've heard, a large portion of the people who have come, up positive are one, young adults,
Yeah.
and two, either asymptomatic or very mildly symptomatic, people who really wouldn't have known unless they were asked to go take a test. So, that's part of why we haven't jumped out and taken sort of drastic action from a city perspective yet, because these are not a bunch of hospitalized cases. We don't have, I'm not aware at this point of any new hospitalizations from these cases in Stillwater.
Is that what, when I have Senator Coleman on, that's one thing he says, he's watching the hospitalization. Is that what, I think, by the way, I think people probably have the wrong impression that you're spending all day long, every day, studying this. You had other duties, and there's really kind of only so much you can do. You're keeping up on it.
We talk to the health department, we talk to the hospital. I do, try to read as much as I can, and I've been in, try to get on webinars or Zoom meetings with other mayors and folks around the country who are talking about this stuff. So I've spent a lot of time trying to figure out, what the best course of action is for these different things. But yes, this is not my. I am not an epidemiologist, nor am I a full-time mayor.
So I just imagine when people see you, they're probably going, okay, what's next? What are we going to do next? What's next for the city of Stillwater? And I'm probably even guilty of that. We'll have the mayor in to tell us what's down the road.
And that's reasonable. I mean, that is what we do. And that's from my perspective. I mean, we do have to make decisions on the city from a policy perspective. We have a council meeting tonight that will get, this will get talked about quite a bit, I'm sure. Because the council is involved in those decisions and can be involved in those decisions too. So we're looking at all those factors, right? I mean, when people say, well, at what point do we take a step back in this whole reopening process? Well, the hospitalization piece of it is important, right? The total, we're looking at statewide. The state does publish numbers on the percentage of tests that are positive, right? Because you say, well, okay, we got a ton more tests, we're going to have a ton more positives. But is the percentage of those positives, is that actually getting bigger, right? Are we getting more positive people testing? And overall, I think the state average has been up the last few days. But again, I mean, in Stillwater, at least, the percentage positive is definitely up, right? Because we had 0% positive for a long time before this. But it's, you can understand why it would be, given that, people are being told to go get tested who have no, who may have been exposed but have no symptoms, right? So we're looking at that. We're looking at the total. Stillwater has been really, really low from a per capita infection standpoint from the beginning, right? And partly that's because a lot of our population didn't come back to Stillwater after spring break, and some of those folks have come back now since June 1st, when a lot of leases start, and since the town sort of started reopening. So I think our population is up. I don't have, just specific numbers on what that looks like, but there are more people in town. So from a per capita perspective, we would expect to have more cases. So there's a certain number of factors that go into this that you look at it and go, okay, well, it doesn't necessarily require drastic action at this point, because it seems to be very specifically centered around the young adult population, student age kind of folks.
And hospitalization is a key.
Yeah. I mean, we only closed stuff down because we wanted to protect the healthcare system. From the beginning in March, the reason that everybody went to talk about flatten the curve and protect the healthcare system was that you didn't want a big spike in people in the hospital. We're not going to keep people from getting sick. People are going to get the virus and they're going, potentially to be sick. But what we do need to control, what we have to be able to control is keeping the hospital from becoming overwhelmed. And at this point, we're not seeing that as an issue. Now, the more these cases are in town, the more possibility there is that they do get in contact with more vulnerable populations, and then potentially those folks that end up in the hospital. And so what we're trying to do right now is education, and especially with the younger adults, with student age folks, talk about, listen, this is absolutely spreading among college age student population in Stillwater. There are, and it seems like if you look at the places that have announced that they had an employee test positive, that's not something that the city does. We don't have any information about where somebody works until their employer says we're shutting down. But if you look at that, you certainly see places that population works. And
When
so,
you think when you were 20 years old and you were going out, you weren't social distancing wasn't part of your plan that night, probably. So that's where we are now.
sure, yeah.
So what about places like SASA and stuff? I know that we were talking about tournaments and stuff like that, and Carolyn does a great job out there. Are you keeping in contact with those folks, and what are the concerns there?
Yep, spent some time on the phone with Carolyn just on Friday, kind of talking about what they're doing. They're still, what basically we have them. They're playing games, local league games right now, with extra precautions in place, right? So the bleachers aren't there, so you can't go. The crowd has to spread out and that sort of thing. They seem to be doing okay. I think we had talked about their plan. If they were going to bring tournaments to town, it would be later into next month. And so we'll continue to assess that. I think, it's just one of those things that I think we have to take on a case-by-case basis and try to figure out what's.
So that was like July
what's the
15th
situation.
instead of June, wasn't it?
Yeah, I mean, that was, and there wasn't really a specific date.
Right,
I think
yeah.
it was really just, kind of when things were
Sure.
going to work and when they might be able to organize a tournament later in the summer. That it would be later in July if they were going to do that. And so we'll continue to talk to them about it and sort of figure out what the situation is and how the numbers look. I mean, this is a day-to-day kind of a concern. I mean, we'll look at just like the school district sort of saying, hey, they were going to bring athletes and activities back today, and they made the announcement yesterday evening, basically, hey, let's hold off for a couple days and sort of see where this is going, because I think it's possible that we could see it flatten back out, just because you did see such a surge of people coming in June 1st, and bars were open, and you kind of had that, okay, everybody's back in and let's go do stuff. And I think this could correlate to sort of that opening weekend kind of situation, and maybe it flattens back out once people are like, oh, we got to be a little bit more careful, and if we can get people to be more careful and pay more attention to social distancing, then maybe it does kind of level back out. If it doesn't, it's a different conversation. So.
I know one of the things that Scott Petty was concerned about, and I think I saw that they put out, Stillwater Medical put out a video, so I think with Shyla, it seems like, talking about where the numbers are going. If you filled out your form and you said, okay, I'm from Denton, Texas, if you're a student, do we know about that? If some of the people who are testing here?
We don't. We don't. I mean, that's one of the unfortunate, things about our specific population and the demographics here in Stillwater, is that if, I think there's a couple different scenarios, right? One, I mean, if you're here in Stillwater and you're feeling sick and you're, concerned about it, and you're from Oklahoma City or Tulsa or whatever, there's a good chance you're just going to go home, and maybe get tested there in the first place and not even mention it to anybody that you were in Stillwater. Well, you could have been out in Stillwater for the last week, and no one, here really gets. Right. Now, if you test positive in Tulsa County, the Tulsa County Health Department starts doing contact tracing, and they're going to talk to you and say, well, I was in Stillwater last week and I was at these places. Then they're going to let us know. They're going to let the local health department know and see if there's anything that needs to be done. But that's going to take a week or two before we really know anything. So then the other scenario, is someone who's, say they're from Dallas, they're here, but when they go in and ask for, when I call the health department and they ask me for my address, I mean, I gave my local address, but
Right.
I guess if you're thinking, I think a lot of students go, well, if it's a medical thing and I'm on my parents' insurance, I need to give them my parents' address, and so they give them their parents' address in Dallas.
Kind of ties
Um,
in with the census issue we were having. Yeah.
exactly, it's exactly tied into that, and so I don't know if the health department can or will potentially start saying, well, what do you have a Stillwater address, or are you here? Why are you getting tested in Payne County if you live in Dallas or whatever it is? But I think if they do test positive, from a test given here, then we will follow up with them contact tracing wise and can figure that stuff out. But I still don't know that their numbers ever actually show up in our local numbers, right? So,
Right.
I mean, we'll still do contact tracing on them. We'll still, try to figure out if they, affected anybody else here locally, but their numbers might not be there. So, we have 50 new cases since June 1st. Well, that could be 65, 70 cases, really, if there are students who have been reporting an out of Stillwater address and we just don't know. But
This contact tracing is interesting. Did it even exist beforehand?
sure, yeah, this is something that the health department has done. They do with infectious diseases. You're right. I mean, if someone comes down with, I mean, they don't do it for the flu on a
Right.
normal flu season, but
If you had malaria.
yeah, I mean, if you
Yeah.
had other kind of, certainly if you came into town,
I never heard
and
the term.
you had yeah, that's, it's certainly one of those terms that we've all learned from this scenario that we'll now remember.
Well, to give a little credit, I know they're overwhelmed right now, and whether it's the unemployment office or the health department, I wouldn't want those jobs. But when Rob was in with Audio Midwest, he said, he was in quarantine because he'd been around a football player who had come into his store.
Yep.
But they were calling every day. It'd be a computer,
Yep.
but they ask you certain questions, and then you answer those
Yep.
numerically or whatever it is. That's pretty impressive.
They really are. I mean, that's one of the things that it's given me some more comfort,
Yeah.
right, with the reopening and with kind of where we are, with new cases coming in. Because again, back in the beginning of March, when we were talking about a huge surge of cases, we were concerned, well, is the health department ready for this? Can
Right.
they keep up? Because contact tracing, without a vaccine, without a treatment, you've got to be able to try to figure out where these cases are. And as soon as somebody might have it, keep them in quarantine so that they can't give it to somebody else, right? That's the only prevention is the only, tool we have at this point, and contact tracing is a huge part of that. But they, Kelly Rader and her staff at the Payne County Health Department, and she really runs all of District 3, which includes like 6 or 7 counties around us. So they've got a lot going on and a lot to do. But we talked on Friday and said, hey, we've got new cases. Do you guys still have the capacity to do this? They said, yeah, and they have a lot of people sort of on standby. And the state has kind of mobilized, places in other areas maybe where they're not having as many cases right now that they can come in and help when it comes to contact tracing. So I feel confident that we're doing that well. I think one of the concerns is, and I think one of the things that people in the public need to really hear is there's a difference between, so if you were in contact with somebody who's positive and, you were in contact with them on Thursday last week and you go in Friday and get tested and it's negative, that does not mean you get to go out and
Right.
do whatever you want, right? Because it could take a couple of days before you even have enough viral load to test positive. And if you have been in contact with someone who tested positive, you need to stay at home. You absolutely need to stay at home. Even if you're going to get tested, honestly get tested a couple of times, a few days apart, just to make sure, because it can take some time before it even shows up. And just because, you don't feel sick within a couple of days of being around this person does not mean you don't have it, and does not mean you can't give it to somebody else. And that's the way this thing gets really out of control, is when people, are not being careful about the fact that, hey, I may have been in contact with this thing and I need to stay home and make sure I don't give it to somebody else. So if you've been asked to quarantine, for sure. I mean, we have had some issues with people who either tested positive or who were in quarantine because they were waiting on test results, and had specific contact with positive people who were not following the rules. And the health department they do have legal authority to make you stay home.
Okay.
At this, for most, purposes, what they're doing is saying, hey, you need to do this. Here's what we want you to do. But if you're not going to follow the rules, they can make you. And we really, really need people to be conscientious of their neighbors and of their community. If there's any concern that you might have it, or you might, you know, know somebody who did, or been in contact with somebody who's had it, take every precaution you can to give it from somebody else.
Yeah. So if one particular high-profile guest of mine does test positive, Will Joyce will be in this seat tomorrow.
Nope.
Mornings
host.
with the mayor. What do you think?
Yeah, I mean that's it's tough. I mean it's and of course you get he was in touch with this, and I was in touch with that, and you're trying to figure out how many steps down the line do I really have to be worried about. But here's another thing, Steve. I want to just put out there. I mean, you've seen restaurants close or stores that have closed because they had somebody test positive, and I've had a lot of people say, "Well, I just ate there last week. Do I have it?" Right. Well, the risk of contracting the virus from just being at a restaurant with somebody else who had it, right, is pretty low, right? The high risk transmission factors are within 6 feet for 15 minutes or more. Really, it does take some close personal contact. I mean, to be a really high risk, right? You're not going to get it for passing, just having walked by somebody who had it, right? So,
Will, do we know that, say you're asymptomatic, as it turns out. Do we know whether you're more contagious than if you were actually visibly sick?
I don't think we know degrees of contagion, based on symptoms. I would assume, the more symptomatic you are, potentially the more contagious you are, but that's a guess on my part. I know that, there was some discussion because the World Health Organization came out and said, oh, asymptomatic people may not be that contagious. And then they came back like a day later and said, well, no, that's not what we mean. I think you can just tell just from looking at what we've seen in spread in Stillwater. There's a lot of these cases that we've tested that have come back positive that are asymptomatic. And they got it from, they're going, well, this person, I was around that person, I know they were positive, but they didn't have any symptoms, right? And so...
Well, we would have never known about the football players unless they were football players.
And the fact, just the fact that you're seeing it still spreading, to me, again, I'm not an epidemiologist and I don't study this stuff full time, but it would seem clear to me that we're seeing asymptomatic or very mildly symptomatic spread. This is the other thing. It's allergy season. You could just have a little sniffle or a little sore throat, and not even really think it's this, but you could have it and pass it along. So I just since the beginning of this thing, we've been talking about act like you have it. Act like you have the virus and do what you can to keep from getting somebody else. Please wear a mask when you're out in public and you're around people. If you're out at the store, if you're out, whatever it is you've got to be out for, there's no reason for you not to be wearing a mask because you could have it and you could pass it on to somebody else. And I think the concern and the reason we're seeing numbers that we're seeing is that people think, I don't feel bad, I don't have it, I don't have to worry. And that's why we're seeing the surge that we're seeing.
By the way, I just got a text. I guess I can share this.
Sure.
My guest is still feeling really good.
Good.
He just wanted me to know. So, and I'm very happy to hear that too.
Well, so. And that's I am too, and I'm hopeful. There's a lot of folks who again, it's a younger population that we're seeing test right now, but those people have parents in town, and they work with folks, and there are more vulnerable populations that they come in contact with. So that's really the concern. We've got to tamp down on to make sure this doesn't get out of control.
Yep. Hey, we'll take a time out, then we'll dive in. You got a meeting tonight.
We do.
We'll do one more little segment here. As we roll on, the mayor is in. Will Joyce.